So the pathological condition that I chose was nail patella syndrome, and 2 x-rays or x-ray projections that I chose to do that would help diagnosis are an AP pelvis and an AP knee. So first I would grab my patient and use 2 identifiers to identify her, make sure she's got the correct name, correct last name, birth date, and I'd obtain a descriptive history. And then I'd go ahead and lay her down on the table, and I would get a 14 by 17 inch cassette, and I would place it into the table bucky. But since we don't have a table bucky here, I just put it underneath her for now. And then I would have her lay straight and make sure that she's not crooked. So I'd come over here and make sure she's straight along the table. And then I would put the tube into detent, and I'd line it up to where the IR is in the table bucky, make sure it lines up. And then I would make sure that it's in detent transversely, and that the SID is 40 inches. And then I would have her rotate her legs in 15 to 20 degrees. This is so it places the femoral necks parallel to the IR. Now I'm going to center. Since I have everything lined up, all I have to do is move the patient on the table. And the centering for the AP pelvis is midway between the ASIS and the pubic symphysis. And then you're going to go midway between that, and that's where you would center this way. And then you would want to center midway between on like the midline of the body. So then one way to do that is by palpating for the xiphoid process, which is right here, or you can double check by feeling for both ASIS and making sure it's in between it midway, right there. And then now I'm going to make sure there's no rotation. I could check for rotation by making sure that the ASIS are equidistant from the IR, and it looks like they both are. So she's not rotated. So then once I know everything's lined up and nothing's rotated, I'm going to put my left marker in the left upper corner of the patient's left side. And then I'm going to measure from where the central ray would enter through where it would exit. Since I don't have calipers, I'm just going to do my best here. So it'd be about 23 centimeters. So then I would take the 23 centimeters and I would go outside the room and shut the door and look in the lookup chart underneath the pelvis and the bucky and look for the 23 centimeters to get the KVP and mass that I would need. I would put those into the control panel and then select the table bucky and the small focal spot. Then I would tell the patient to take a deep breath in and hold it, and then hit the exposure, and then tell the patient they can breathe. And then I go back into the room, and now I'm going to do the AP knee. So I'm going to take this out from underneath her. Now I'm going to take it out from the bucky and the bucky holder in the table. And now I'm going to place it into the table lengthwise. And I'm going to make sure everything is realigned. So I'm going to make sure it's in detent and everything. But since everybody has different hips, you're going to want to check from where the ASIS is to the tabletop to see how much it is. So she's about 20, so I wouldn't have to put an angle on the tube. So then I would just bring it down here, make sure that the tube lines up with the IR and the bucky, and make sure it's still in detent transversely, and then make sure it's still at a SID of 40 inches. And then for the knee, you're gonna center a 1/2 inch distal from the apex of the patella. But first I'm gonna make sure that her feet are pointed up towards the ceiling and that her legs straight. And then, so I'm gonna locate the patella, which is right here, and the apex, and go a 1/2 inch distal from that. So that's where I would center this way. And then I wanna go in between her medial and lateral aspects of the knee. So I'd go about right here. So then this would be the centering. And so this is all lined up. And then I'm going to place the left marker on the outside or lateral to her knee right here. And you're going to want to collimate to 10 by 12 lengthwise for the knee. And then I can also double check to make sure there's no rotation by making sure her foot's straight and checking that the epicondyles of the femur are both equidistant to the IR. And then I'll measure from where the central right enters to exits. So from here to here, that would be about 13. So then I would grab a shield and place the shield over her lap, because for this one you can shield, unlike the pelvis where in females the gonads are going to be within the pelvis region, so you can't really shield there. But if I had a shield, I would have shielded her, either her breast tissue or her upper femurs. But since I don't have a shield for the knee, I would just place it over her gonadal region. And then I'd go outside of the room and shut the door and put in the 13 centimeters into the, or look it up in the chart, and get the KVP and mass that I would need for the exposure. Make sure that it's on table bucky and that there's a small focal spot. And then I would just tell her to hold still and take the exposure. There's no breathing instructions for the knee because it's on the leg. I mean, it's not near the lungs or anything, so you don't have to worry about breathing technique. And then I would tell her to relax and that she's all done. I don't think there's anything else that I need to mention.
I'm one happy patient.